I think the big concern is the platform itself. So these 15 that are in the pipeline, it's really quite simple. The human cells are intended and were created to make human proteins. Nothing more, nothing less. Your body was meant to make your proteins. So to be hijacked by a system, a lipid nanoparticle putting a gene into your cells, and Dr. Hagemann out of Germany in the European Journal of Immunology showed in his paper a process called antibody-dependent cellular cytotoxicity. When your cells start to manifest a foreign protein, they get attacked. You saw Dr. Burkhardt's slides. All that inflammation is because the cells of the human body are making a protein that they are not meant to make, and then the immune system says, those don't belong here, we're going to attack and destroy it, which can lead to all the pathology that you saw. Now, these pharmaceutical companies and these regulatory agencies around the world say, hey, you know, something new. Normally it takes 6, 8, 10 years more to get a vaccine to market. And that was a traditional protein. These aren't vaccines. These are gene-based products. The governments of the world are cheating and lying and not putting them under the scrutiny of a gene-based product protocol for regulatory approval. The platform must be stopped. And what's the long-term sequelae? I'll honestly answer, I don't know. I don't know. I mentioned Dr. Roltgen's study out of Stanford. We know that it was persisting at least 2 months in the body, the synthetic mRNA, at least. They stopped so they could publish. That's how academics work. But there are plenty of other studies showing the spike's still present 4 months, 6 months, 8 months, 12 months, 15 months later. We don't know when the body turns off. And Alexander is right. These truncated, fragmented proteins, what are they going to do? I don't know. Nobody knows is the honest answer. So you don't willy-nilly keep pushing forward with something with horrendous breadth of side effects, thinking we're doing something good for humanity. Common sense is not so common. Common science is not so common. And so we have a problem. We've got to stop the platform and quit this absolute hubris and arrogance to think we can play God with the human cells.